I am now pleased to introduce our first speaker, Dr. Ken Duckworth. Dr. Duckworth serves as the Chief Medical Officer with the National Alliance on Mental Illness. Dr. Duckworth is a leading mental health expert, board certified in adult and child adolescent psychiatry, and has extensive experience in both the public and private sectors. We're so honored to have him with us today to share NAMI's recent work on mental health. Dr. Duckworth?
Thank you, Catherine. I'll be speaking for about 10 minutes or so. Make sure we have time for conversation. We have two other terrific speakers as well. So reduce suffering on your part. I only have 2 slides. So let's take the first slide, please. So as Catherine mentioned, the pandemic has been a watershed moment in mental health in many ways. And one of the biggest is many more people reported having the experience of a mental health condition. And in this, I say, best of its kind survey to date, the CDC indicated in an online survey of June 2020, so that's 3 or 4 months into this, reported out in August 2020, about as close as a real-time biopsy as you're going to find. Many people, 41%, reported a true mental health condition. So they used the PHQ-9, the GAD-7, a trauma scale that's validated. And if you take a look at this, anxiety and depression, 31%, trauma, 26%, increased substance use, 13.3%. Suicidal ideation increased to a pretty high number, over 10%, and it was higher in young people. They didn't do age, 10 to 17. They started at 18. They wanted to do adults. Hispanics were higher. Black respondents were higher. Unpaid caregivers for adults were higher. Much more suicidal ideation. And essential workers. So this is a transformation. In my way of thinking about this is that mental health went from a they problem to a we problem. I was impressed that I probably did 8 times as many media conversations in 2020 as in 2019. People wanted to talk about recovery, telehealth, connecting with others, how to find a therapist because of the supply-demand mismatch. And I feel like it was a transformational moment. And if there is a silver lining to the mental health aspects of the pandemic, it is that so many people experienced it in themselves or in their family members, right? So with 41%, if you have 5 people in your life, it's now statistically unlikely that none of them are involved in having a mental health condition that they're experiencing. Let's go to the next and final slide, Catherine. So I took advantage of this opportunity to write NAMI's first book. And I made a very deliberate, intentional set of decisions about the book. The National Alliance on Mental Illness, which is your largest grassroots organization in America for people with mental health conditions and those who love them, has never had a book. And I always thought it would be a good idea. I want to emphasize this book, which is up for sale on Amazon. All proceeds go to NAMI. This is a love gift on my part. This is something I just wanted to do for NAMI. Book's going to come out in September, and I wanted to tell you a little bit about it because this is one of the things that NAMI is doing. NAMI also led the 988 crisis phone call movement. So, 988 will hopefully become the 911 of mental health crisis for the National Suicide Crisis Prevention Suicide Prevention Lifeline. It doesn't really create services. That's another advocacy challenge, but I would say that's big recent NAMI activity. The book, I interviewed 130 people. I interviewed real people who used their names. I did not use composite people or fake people, as many books do. The whole idea of this is to reduce the shame and discrimination. Those wolves that you hear in the background are 2 dogs, one a nearby neighbor's dogs, and they've decided only during my talk to get quite involved in battling out each other. So don't worry, nothing terrible is happening. It's just 2 dogs. This is the joy of home work in the pandemic. 130 people, about 80 of them have first-person lived experience, about 50 of them are family members. And I asked them, what worked for you? What made a difference for you? What helped you communicate in your family? How did you manage some of the tensions in our field? And then I also did something that I hadn't seen in a book, but I always wanted, which was to have America's experts answering the most common and important questions that I get as the NAMI Chief Medical Officer. And so this is both first-person questions and family questions. So the first-person questions would include, why should I participate in research? That's answered by Josh Gordon. I get that I have bipolar disorder. Do I really have to take these meds forever? That's by Dr. Andy Nierenberg at Mass General Hospital. How do I think about interventions for self-harm? Here's a discussion of DBT by Marshall Linehan's mentee. Is clozapine the drug of last resort? These would be examples of first-person questions. And in the family questions, for example, I had Dr. Bill Miller, who invented motivational interviewing, answer the question, how do I get my family to talk to someone who doesn't seem ready for help? Dr. Christine Moutier, the medical director of the American Foundation for Suicide Prevention, answer the question, my family member is expressing suicidal thoughts. How might I approach that? So the joy of this project is this is a practical book that is based on real people's stories and what they have learned. In this way, the real people I interviewed are also experts. They have a different kind of expertise than the director of the National Institute of Mental Health or a world famous researcher, but they are also experts. And that is the joy of this book. So if any of you are inclined to buy it, go right to Amazon. If you want me to do an event for your organization related to the book, send me an email, ken@nami.org. I have 130 people from 38 states, and I'm going to be traveling America beginning in September, and I'll have people from the book on the stage with me everywhere I go across the country. So 988 is a big material intervention that NAMI's doing, and the other big project happens to be this little book that I worked on. 988 is kicking in about July 16th and is going to simplify people's experience of seeking crisis services, but it does not itself create services. So I want to emphasize those are two major things that NAMI is working on. NAMI has support groups, peer support groups, educational programs in schools. It covers the entire waterfront of peer support that is all free, whether the peer is a first-person lived experience or as a family member. So I want you to know about NAMI. I want you to know NAMI is a beautiful organization filled with amazing people. I only scratched the surface in terms of my interviews. So Catherine, I'm going to stop my remarks there. I think I'm at 10 minutes. I'm happy to pick up questions near the end of today's session, and thank you for having me.
Thank you, Dr. Duckworth, for your leadership and for sharing a little bit about this book, and we look forward to having you on for the Q&A.